people very often, when they have anxiety, they kind of think, okay, if I channel my anxiety to just get my stuff done, or when I achieve this, or when that happens, and then I'll be able to rest.
Dr. Cheryl Arutt is a trauma-informed clinical and forensic psychologist, certified EMDR therapist, and specialist in the nexus between trauma and creativity. This is from the More Than Anxiety podcast by Megan Devito, who begins this excerpt. See show notes for links to her episode and other resources.
A lot of my listeners are women who are very anxious, yes, but also very goal-driven or very forward-focused, but they notice they get stuck in that cycle of, oh, but I feel so awful, or I'm thinking all of these things. So that's really most of the people who are listening to me. So when we get into that place and we know that these people who are very, trying to move forward and feeling stuck, sometimes they have past trauma, sometimes they don't. So how can past trauma experiences maybe make their anxiety worse? Or for people, is that something that you see specifically in people who are more goal-driven, as opposed to someone maybe that's like, everything's fine, I'm just floating through?
There's so much to unpack in that question. Yeah. That's a really, really good question. I'm hearing that you see a lot of people who they're driven, they may be very high achieving, very high functioning. People may look from the outside and be like, oh, you have your act together. I see this a lot because people very often, when they have anxiety, they kind of think, okay, if I channel my anxiety to just get my stuff done, or when I achieve this, or when that happens, and then I'll be able to rest. Then I'll be able to sit back and chill and relax. Then I'm going to feel good about myself. And what I found in my practice with all these years is that people just keep kind of moving the goalposts, and they'll achieve it. They'll get that great job or the relationship, or, they want to have a baby, then they have a baby, then they're stressed about the things that have to do with the baby. Or I refer to them as feeling states driving around looking for a place to park. It's kind of like I feel something, and it's like, maybe it's because of this. Oh, no, maybe it's because of that. And you can just throw endless, you're nodding, you know what I mean? And so what I very often see, because a lot of the people in my practice are, actors and performers and people who have a platform, a lot of times people will think that when they achieve a certain level of success, that they're going to feel differently about themselves. They'll feel like, now I'll feel whole, I'll feel okay, I can relax. And what ends up happening instead is, why am I still me? And why am I still struggling with this? So the tools and things that we can teach people about anxiety and how to relax and all of that can do a lot, and it are really, really helpful.